Good morning, everyone. I'm Jill Chadwick. I'm Director of Media Relations, and I'm filling in for Dr. Stephen Stites. He's the Chief Medical Officer, and we are coming to you from the Dolph C. Simons Jr. Family Broadcast Studio. With us in studio this morning is Dr. Sean Coomer. He's Vice President of Perioperative and Procedural Services. And in Studio B is Amanda Gardner. She is the Director of Quality and Safety, and last night, she was awarded. She was honored as what I just heard Dr. Coomer say this morning, the LOI, which is Leader of the Year, is cute. But anyway, it's an internal honor that we bestow on leaders every year. And this year she got it for all the hard work that she's been doing. So big round of applause to everybody at home. Thank you, Amanda Gardner. Thank you for being with us this morning. All right, we are going to answer your questions this morning. But first, Dr. Hawkinson, Medical Director of Infection Prevention and Control. Welcome. How did we do overnight?
We're good. And yeah, she is kind of my boss-ish in the medical directorship, so she does a great job and keeps everything running. That's good. So, but she does a really, really good job on the quality and safety and infection prevention, as everybody knows. Today, our numbers are down. The numbers in the hospital are like golf scores. The less is better. We did have a peak of, high 70s, but now we're down to 67 acute infections in the hospital, with 22 of those in the ICU and 7 on the ventilator. We still do have 28 patients in that recovery period and 3 on the ventilator that are still here, unfortunately. We did have 3 deaths overnight or within the last 24 hours as well. Unfortunately, Hays is having an increase too, though. They do have 24 active patients and 1 in that recovery period, so their numbers are probably about as high as we've ever seen, and that is then a larger proportion of their total hospital beds. So.
All right. Well, today we're going to update efforts underway to identify extra beds for potential COVID-19 patients. We know that we started talking about that yesterday a little bit, and that's why I invited Dr. Coomer to come in, because after the update, we had lots of questions. So the news that Dr. Hawkinson just shared about us having fewer patients, does that mean you're still planning?
We're obviously still planning. This can change on a daily basis as we see. We watch those numbers, and they tick up and then they go down, and we breathe a sigh of relief, but unfortunately things can change quickly. So we're really in a different place than we were back in March, and many people know across the metro, we shut down a lot of the ORs because of, number one, we didn't have the PPE necessary. We had blood shortages, we had medication shortages. We're in a different place now. We feel a little more comfortable about that, but now it's come down to beds, and that is scary, right? You can't take care of your loved ones and folks around the metro. So we have asked, we sort of have a rule of twos. So we've asked every department to defer cases. And we're not talking about elective cases, it's a little bit different. We're deferring cases. And so somebody might have a cosmetic procedure or a benign lipoma or something like that, they could wait a little bit. We're asking them to do that. So 2 cases per department that have length of stay of 2 days or more. And as a result, we'll gain some beds that way.
And that is different also to how we approached it in the beginning.
Yes.
And talk a little bit about that, because that had a trickle down or a domino effect. And why this more measured approach as opposed to back in March and April when we just said, okay, we're stopping?
Yeah, no, it's, there's no doubt about it. This is rationing of care, and we don't feel good about that. And the rationing care we did back in March was more emergent, and that was a problem, but it deferred care, and there were people that didn't get necessary screening procedures or the cancers diagnosed, and it created a big rush after that, and we were extremely busy through the summer and through our entire first quarter, and we continue to be very busy. But we just shifted our thinking a little bit. So obviously we're going to do those emergent cases, the cancer cases and so forth, and we're doing outpatient cases, which is opposite logic than before. So when we're doing outpatient or one-day stays, we'll continue to do those, and we're shifting those around between our outpatient centers, our inpatient hospital, and it's just a little bit different thinking.
And also, I guess one other question that I might have is, It's safe to come and still get surgery. I know we talk about that all the time. Talk about how are we still pre-testing patients for COVID before you allow them to do a procedure?
Yes. So considering the gravity of the procedure and the emergency of the procedure, but if there's something that's very timed, we try to get them tested 48 to 72 hours beforehand. So we're not undergoing a procedure when somebody's actively infected. And that's for the safety of the patient first and foremost, because there are some comorbidities that can really arise and more complications because if you operate on somebody with COVID.
All right.
So, but it is definitely safe. Our people are safe, our patients are safe, and we'll continue all of the great work that IPAC and all of our colleagues have done throughout the entire hospital. I can't say enough about the hard work of everybody on the front lines. They're really in the trenches, and they're tired and they're worn out, but they are fantastic employees and staff, and I'm just so proud to work with them.
That's awesome. Well, I want to talk to somebody who knows a little bit something about IPAC. Amanda, we are also getting kind of questions about, back in the beginning, there was struggles and concerns with PPE and those kind of things. Tell us where we're sitting in that regard.
Yeah, our supply chain has been doing an amazing job of getting the right resources and supplies so that we can adequately take care of our staff with the right PPE. And we get an update every single day. They're finding new availability every single day, and they're taking advantage of what we can order so that we have a good supply here, and we are doing really well.
We have Okay, so I want to just be really transparent. I'm juggling a lot of things today. Normally I do this over in the corner so you guys can't see me, but Dr. Stites and Dr. Wild, they're involved in some calls this morning on the surge that's going around in the community. And so I'm going to do both jobs. So when I'm doing this, it doesn't mean I'm not riveted by what our doctors and Amanda is saying. It just means that I'm trying to get to your questions. And I have one. Audra wants to know, are we having drive-by testing still? And are those crowded? People are having trouble finding a place to get testing. Who wants to go first? Amanda?
Yeah, so we still have the Indian Creek and the main campus drive-through swab clinics available. That hasn't slowed down at all. We actually are increasing our number of tests that we're doing every single day. So that is still an option, yes.
All right. Anything you want to add to that? You're just sitting over here very quietly.
I mean, I'm riveted. It's great stuff today. And it's Friday, so we all get to have some time off. No, that was exactly correct. We are still doing the testing. It is a drive-through clinic. You have to call ahead, 913-588-1600. That will help. If you have another physician, especially part of the health system, they can order it as well. They are very busy, so they are trying to call and schedule people, but sometimes it takes a little bit longer. But yeah, we still have those testing.
All right. So before we get to the questions that we didn't get to earlier in the week, you are asking some good questions this morning. Loretta wants to know, how do doctors and nurses take care of yourselves? You first.
It's interesting. I have sort of a dual job. I continue to operate and stay fairly busy, take a lot of call for transplant surgery, and I also have cancer surgeries. And then, of course, I work with a great team in peri-op and procedural. And so it keeps me pretty busy. I try to exercise a little bit. And my wife is probably watching right now, and she's probably laughing that she doesn't think what I do is exercise anyway. So, I try to exercise a little bit, but I stay pretty busy clinically and with a job, and I really kind of get myself lost in it, and I enjoy that a lot.
All right, Dr. Hawkinson, how do you take care of yourself?
I think it's activity, trying to walk, be outside, walk or run. Go to the gym if I can, with a mask, of course. But then it's otherwise just doing, aside from medical and COVID reading, it's just reading for fun. And recently, especially during this election, it's really been trying to shut off from the internet as well. So I think that helps.
Amanda?
Yeah, so a lot of my team work remotely, so we try and do like get-togethers virtually, even for just 10, 15 minutes every other day, just to try to have some social contact in some way. And then kind of agree with what Dr. Hawkinson said. The more time I can spend outside and do some kind of activity, I think it really impacts my positivity and my mood.
All right, Cindy Young wants to know, is the way PPE is being used in the hospital changing with our knowledge of the virus? Amanda, I'll start with you.
Yeah, we continue to hear about new publications and see information, but we have really stayed to our core of the universal masking and eye protection if you're a patient-facing employee. We've implemented respirators whenever they're absolutely necessary, and that is with the aerosol generating procedures. And that has worked since really probably April or May. So we have not made any significant changes to our PPE, even as new information becomes available. It's not suggesting that we need to make any drastic changes.
All right. Do either of you want to add anything to that?
I would agree.
All right.
Perfect answer.
Lindsay Shively with KSHB, I am told, is on the line. Lindsay, do you have a question for our panel?
I do, guys. Good morning. We heard from Missouri Governor Mike Parson yesterday that they were changing guidance for K through 12 to consider close contacts. You would not be a close contact, they say, if both people, the positive case and the person exposed, were properly wearing masks, even if you were within 6 feet. Could you talk about what do we know about how much masks protect you?
Mm-hmm.
Dr. Hawkinson.
Yeah, so we have to start that we have always said for the community, not in the healthcare setting, but for the community, masks serve as a barrier. So they serve as a barrier in case you know that you're ill and you're still out, which you should not be. You should be isolating at home. Or if you don't know that you're ill and you're out and about, so you are not spreading the virus into the environment. On top of that, though, we said that masks do and have previously shown to offer some protection to the wearer, and that's even the cotton mask, the 2 or 3 layer cotton mask, not just the surgical mask or the N95. There was a recent publication, again, done in a laboratory setting with mannequins, that did show that masks do provide protection for the wearer as well. So that is one more data point to suggest that even cloth masks will protect the wearer from getting the infection. Now, it should be noted that under the CDC guidance, as far as being a close contact, it doesn't designate whether you are wearing a mask or not wearing a mask. So unfortunately, even if you were within 6 feet of a person for 10 to 15 minutes, you would still be considered a close contact, even if both parties had the mask on. Now, what Governor Parson was referring to was these changes made on if you are a close contact so that kids can continue to go to school. I don't know all of the data on this, but I know that they did consult with some pediatricians and looked at other data from Iowa and maybe Nebraska, apparently, possibly saying that this has been done and it didn't see any rise in any cases. I don't know all of that. I don't know about all of that data or anything of that nature, but what we can say is that from CDC guidance, it doesn't matter if both parties are wearing a mask or not wearing a mask. You would still be considered a close contact if you were within 6 feet for 10 to 15 minutes or more. So we still use that definition here, and that is regardless of mask use.
Amanda, I see you nodding your head. You want to add?
I don't have anything to add. He's right on as in regards to the way that we are managing our close contacts. Still, if you're within 6 feet for 10 minutes or longer, regardless of wearing a mask, you're considered a close contact.
And I think it's important to note, too, that, one of the things that we have seen a very good stuff from schools since they've been open, as every individual building has been able to take as much of those engineering protocols and safety measures in place. We haven't seen a lot of spread in the school, but there is always, and what is going on now is a workforce crunch with teachers having to be out from quarantine or from illness, with students having to be out from quarantine or illness. I think it is a dangerous prospect, and again, I think there will probably be more studies on this, but bringing people who are known contacts and possibly infectious into those schools, I think that could only add to absenteeism and teacher and other vital people in the schools being out because of illness or quarantine as well. So.
Lindsay, do you have another question?
No, I think that's it. Thank you.
All right. Thank you for jumping on. Do we have any other reporters on the line? No. Okay. We will continue then with community questions. David wants to know, is it true that the number of hospital beds being used now are 50% higher than back at the peak, I think previously during the quarantine? Is it 50% higher?
Are we 50% higher of COVID beds or just all people? Because we still have, as Sean knows this, we still have a lot of people that are still ill, needing care for heart attack, for stroke, for surgeries, cancer surgeries, other non-deferrable surgeries. So we still have a lot of people who are needing medical care for things other than COVID. Certainly we have seen our numbers here around the region and with our partners in Western Kansas, and all of those COVID numbers are up, but we also know that people are needing and seeking medical care for other things, not COVID.
Right. I think that's very true. When we talked about when we had our dip, our census was probably 50% when we sort of shut things down, not doing surgeries and other things, and really deferring care.
Yeah.
So we're busting the seams now, but as Dana said, we are certainly, the great majority of patients we have here are not COVID related. They are other things going on, whether it's heart catheterization or it's dialysis or it's some other illness or cancer or whatever it might be in surgery. So those are the majority of our patients.
Because we know that people were not coming to the hospital when they were having quote unquote light heart attacks or light strokes.
Right.
They were deferring that, and that led to significant complications. So we need to continue to make sure that people know if you are having problems, whether it's symptoms of stroke or heart attack or other types of infection or illness, please come to the emergency room, come to the hospital, talk to your primary care provider. You need to not defer that care, and we can keep you safe here in the hospital.
And Gail is asking a question that a lot of people are asking, and it has to do with testing. She wants to know, do I need symptoms or a physician's order to get tested? Are the tests free? Can you speak a little bit to testing?
Yeah, so we do have different mechanisms of getting tested. We know that one of the reasons to get tested is if you are a contact or an exposure of a known case. Unfortunately, the CDC doesn't give any guidance on when. We would typically recommend 5 to 7 days after exposure so that you fall into that area where you are more likely to be testing positive even if you are not having symptoms. So that's if you are exposure. You should definitely get tested if you have symptoms. We know that there are other probably cough and cold viruses and maybe other GI viruses that are going around, but you can't tell if it's COVID or not, or if it's one of those other viruses. So it is important to get tested if you are having symptoms. There are places to go. You can start with the county health departments, look at those websites, call those places. We know that other health systems have places as well. You are welcome to call our testing center, 913-588-1600. But also if you have a physician that is here at the health system, they are able to write the order as well. So there are different mechanisms in place to go get tested. You should get tested if you have symptoms. If you are an exposure of a case, you do need to get tested. There's no exact guidance, but I would probably recommend doing it at that 5 to 7 day mark after that last exposure.
And I don't know if any of this panel knows this, but in terms of whether it's free, my understanding is your insurance covers it, and then there's money from the CARES Act if you're uninsured, and health departments a lot of places are offering them free. Correct me if I'm wrong.
Yeah, I think there are subsidies. I'm not sure of the exact billing, but I think a lot of insurance companies now have gone to paying for those types of, especially those PCR tests, maybe not the rapid tests. You really need to do that, check with that information, the benefits, wherever you go to get tested.
Okay, you're asking really good questions today, and I'm going to do 3 more that came in today, and then we're going to backtrack. But go ahead, if you still have more questions, then we'll get back to you people that have questions today. Barbara wants to know first, what about home pulse oximeters? Am I saying that right?
Yeah, oximeter? Mm-hmm.
Yeah. Should she get one? Is it a good idea or no?
Any thoughts, Sean?
I don't know if it's absolutely necessary. You know, some of these are not all accurate. There's definitely some quality issues with some of them out there. It might be a good quality indicator to some degree if you have changes on the same pulse ox, but it's not absolutely necessary.
Yeah, I would agree with that. And I think, Dr. Stites and even our pulmonary colleagues would probably recommend against getting those. I would use that as not a major criteria to be monitoring your COVID disease, but more of, are you having more trouble breathing? Are you having more cough? Are you not feeling as well as, say, maybe 3 days ago? You can certainly get it, but I think a lot of our pulmonary colleagues would be just like you said, and probably not recommend necessarily, because is the accuracy okay? You can certainly have one, but again, I wouldn't use that as one of the major criteria. I would look at the other clinical and how you're feeling and how you're doing to understand, should you need to seek medical care at that point.
All right, Mary says that the World Health Organization says that exercisers are not required to mask during exercise. Yeah. Do you agree?
I've always been a proponent of trying to get out and do exercise outdoors and activity outdoors. When I'm doing that, I'm pretty much away from everybody because I'm walking or running. I'm not coming into contact with anybody. And doing that aerobic activity, the walking maybe not as much as running, but running is very difficult to do mask wearing, such as if you're playing a sport as well, it's going to be more difficult to wear a mask. It might be a little bit easier now that it's cooler. You won't have as much heat that gets trapped. We know from experiments that there is no problem with gas exchange. You get enough oxygen in, you can release enough CO2 with the masks on, especially these surgical masks. So that's not the issue. It's more of the heat and the uncomfortableness about that. However, when I'm in the gym, I am absolutely wearing a mask. So I think it's a matter of aerobic versus anaerobic activity. It's probably going to be much more difficult to wear a mask when you are running or doing the treadmill inside. But at this point in time in this climate, I probably would not be doing, and I don't do any treadmill work inside because I would have to take a mask off, and it's just not, it's probably a little bit more risky. So.
Amanda, you exercise a lot. I won't ask Dr. Coomer because his wife Alex will give him trouble tonight. But when you exercise for real, do you wear a mask?
I am like Dr. Hawkinson. I'm always exercising outside, and I'm usually alone. So there's not really a reason for me to keep my mask on. I think as Dr. Hawkinson mentioned, as you're doing more high intensity working out, it is a little bit more difficult to breathe with your mask on. And if you're sweating, it's going to get wet and it's going to make the mask less effective. So typically if I am working out outdoors or indoors by myself, I don't have a mask on, but I am not going to a public gym at this point.
All right. One more question from this morning, and then we're going to do our backlog of questions. Susan and Isaac are both asking about the vaccine. Mm-hmm. Isaac is wondering if we give it to people who need it the most, frontline workers, people that are at risk, will that be enough to help us tamp down the virus? Mm-hmm. And then Susan, her question is, she has a lot of people that say, I'm not taking that thing. I'm not going to take that vaccine. Mm-hmm. And she wants to know, what can you say to convince people to take it?
Yeah, I mean, those are two pretty big questions.
They are.
Complicated answers. So I think for the healthline workers, there are the rollout plans for the vaccines. We know Kansas has a rollout plan that's readily available. The CDC has a rollout plan for what they want to do. We know that one of the issues that we're running into with capacity, Sean, is workforce shortages. Either just not enough workers, quarantine or illness, not able to staff the beds that we do have. So that is one of the things. So hopefully if we do get these frontline workers vaccinated, whether that's workers in the hospital, but also the people we count on to keep us safe, the firefighters, the EMTs, the police officers, we won't have workforce shortages in that, so that we can have this capacity to do this emergency or urgent medical care as needed, but also the regular medical care as well. As far as vaccine safety goes, Operation Warp Speed in all of the vaccines, all of the trials, from the initial vaccine trials to now the COVID vaccine trials, they have all focused on safety. And we know from the words of Dr. Birx and Fauci that safety is going to be one of the major important things. We have to remember that with all the other great vaccines that we have, nobody was really intent on watching the day-to-day news about the vaccines. And vaccine trials were paused on a regular basis to make sure that everything is safe. There were always setbacks, but they got back on board. Obviously, we hear of any little thing now with all of the vaccine trials. But those things are done in an effort to make sure that safety is at the forefront. So right now, they all do look safe. There have been some pauses, but a lot of the vaccine trials are still going or on, off the pause and are back enrolling and doing them. So vaccine safety will be an important part. And then, of course, the second part is efficacy. We would encourage everybody to get a vaccine. There will probably be multiple vaccines available, though. And so we need to wait and see really what all of the data is once the first one comes out, then the second, then the third. These, again, will probably be only the first generation iteration as well. There'll probably be 2 or 3 generations also. But again, in the forefront of that is going to be the safety of those. And so we really just have to wait for the final data and the final publications to really look at that, deep dive into that, and then hopefully spread that message that they are safe and be able to answer these questions with a little bit more information.
Anything you want to add?
No, I think Dana brings up a great point, is that, for this going to the healthcare workers first, we have difficulty staffing. We have a significant number of employees that are out sick or out with COVID. And, as a result, we can't take care of all the patients. And when we have these waves, it's a big problem. So I think it's very important that they are, the healthcare workers are in the first phase. And then, of course, the safety and efficacy, we'll have to bear out and see what the data is. It's very encouraging what Pfizer said with 90% efficacy, but we'll have to see how that bears out. They're still going through their, and I think everybody says the next 100 days we're going to find something out. And we've been saying this for the entire pandemic. We'll see what happens in 2 weeks, and that's been, we'll see what happens tomorrow. So I think we're just going to continue to react the best we can, and COVID just has us reacting and not being proactive about a lot of things.
Yeah. All right, let's go to our first question that we had from carryover this week. We have a couple of questions from wives. My husband and I attended a live theater show with 600 people. I kept my mask on while my husband and some others did not. He tested positive for COVID-19 days later. I have not. Is it possible that he got it there? And this person who wrote in talked about how they wore their masks faithfully to and from the car, but once they got to the venue, he took his off, she kept hers on. Is it possible? Amanda, what would you say?
Yeah, I think it is possible. We know that the mask serves as a barrier. A lot of times we're suggesting that the mask is really keeping your own droplets to yourself. And if you are in an area where folks aren't wearing their mask, it just puts you at higher risk. So is it possible? I think absolutely.
All right. Another wife wrote, my husband ran a fever for only 12 hours with his COVID-19 diagnosis. Could he get pneumonia or some other symptom later on without running a fever, really? Can he?
Yes, absolutely. Absolutely. Again, there is such a heterogeneity here of people who develop symptoms and what symptoms they are. A lot of people say fever, but that really only happens in 77 to 75% of patients, really. Other patients have loss of smell or loss of taste. Just that initial fever, you can certainly develop the pneumonia. Really, a lot of what the pneumonia is, we have to understand. A lot of what is going on in your lung, and pneumonia is just a general term for infection or inflammation in the lung again, is a lot of that inflammatory process that comes after that initial viral stage of the illness. It comes in that immune dysregulation or inflammatory process that comes later. So you certainly could. We just don't know. Any time that you get the virus, you are always rolling the dice. We understand that if you are older, obese, have diabetes, heart disease, kidney disease, lung disease, you are probably at more risk of those things. And if you are younger, you are probably less at risk, but we know that those can happen to anyone. And we don't really know how to predict who will go on to develop the critical illness and who will not.
You almost lost me at what?
Heterogeneity. That was early in the sentence, too. That was
Yeah, I know.
that
which
just
is
means
a problem.
differences. That just means differences, basically.
All right.
He likes those fancy SAT words.
No, he's teaching
smart
us.
guy,
And your assignment today is use it 3 times in a sentence. Okay. Another question. What are the demographics around the current surge that we're in? Are patients still skewing older with comorbidities and the majority from certain ethnic groups?
We really need Dr. Wild on here to give us those numbers. But what we have seen and what we heard even yesterday with our health officer partners, Dr. Gardner and Dr. Lemasters, that overall the hospitalizations have gone down in the average age. I think it was in the upper 50s or 60s, and now it's down to 55 or so. And that's the average age for people who have been hospitalized. And we have had just a large range of people who are hospitalized, from the upper 90s down to their young and mid 20s as well. So I think overall, yes, there is a difference in the ages, but also more importantly that we saw the last time Dr. Wild was on, the amount of people who have no other known medical problems has increased from April or May till from now to September, October, or even August to October. So that has changed too, and that's more of a kind of a concerning issue.
All right. Well, let's see if we can get him back on next week to answer that a little bit deeper dive. The CDC, the World Health Organization, and even Dr. Fauci said early on that masks weren't needed. So why should we believe they are needed now?
Yeah, I think that's a great question. That was said before. We like to use data, new data points, science. That was before the data that came out and showed how really important it is that we are able to spread the disease without even knowing we have the disease. So for SARS-CoV-1, or the original SARS, you really weren't infectious until 5 to 7 days, or you were most infectious probably 5 to 7 days after you had symptoms. So it was easy to identify a patient, get them in lockdown and isolation, and treat them and trace their contacts. Unfortunately for this disease, we know that maybe up to 40% of people will never have symptoms. And we also know that you are most infectious 1 to 2 days prior to any symptoms, and 1 to 2 days after symptoms arise. So when that was said, it was based on the fact that you probably aren't as infectious if you don't have symptoms. But as new data and new information, and we learned more, as that comes out, it was understood that I can spread the disease to you without even knowing it. So therefore, I don't know if I'm sick, so I need to wear a mask. And that's what the big crux of that is. I know a lot of people go back to Dr. Fauci said we don't even have to wear a mask. But that thinking is backward now. As new data points have come, as new information has come, our line of thinking has changed and evolved with that new information.
Amanda, you're nodding. Anything you want to add?
Yeah, I think he answered that question really, really well. And I think we've acknowledged the entire time during this pandemic that what we know today may not be the same thing that we know tomorrow. And so we have to adjust our behaviors based off of the new information that we have. I think if you were to ask Dr. Fauci right now if a mask is important, he would say absolutely, we all need to be wearing our masks.
All right. Another CDC study shows that 1 in 5 COVID-19 patients is diagnosed with a mental health disorder within 90 days, including dementia, depression, anxiety, and insomnia. The question is, do you know which patients are more susceptible? Do we know? Have either of you, doctors or Amanda, read on this? Is there a way to look at somebody and...
No, I think we know overall that, mental illness is up. Things like anxiety and depression, and people who maybe have had no history of that before. But, the pandemic is changing things, and it is difficult. While some people would prefer not to go out because maybe they have anxiety about going out into public, and so the stay-at-home order was okay for them. The majority of people like to be in social settings, like to be able to go to work and do things in their normal routine. So we understand that the pandemic has really caused a lot of, maybe not full-on mental illness, but certainly aspects of that and signals of that in people, such as the common things of depression and just not feeling like they are doing as well prior to, prior to March of 2020. I don't think we really know of a way to, again, predict that, just as we don't really fully know a way to predict who will go on to critical illness as well from getting the disease.
What is the limit for a safe gathering? Go ahead, Amanda.
Yeah, so I know people want a number around this, but even if you have a very small gathering of 3 or 4 folks that aren't normally in your bubble, that can be high risk. So I think it really has to do with I know originally they had said anything greater than 10 was a high risk, and then the counties have extended that to 45 and then 100 and then even beyond that. But I really think it's not so much the size of the gathering, it's really the activities involved. Can you maintain the social distancing? Are these folks typically in your bubble? Are you introducing new people into that gathering? And that sort of things. Are you indoors? Are you outdoors? Are you eating, drinking? Are your masks off? Those are the things that I think are probably more important than the actual size of the group, because just coming into contact with one positive could make a gathering of 2 high risk.
All right. And I'm going to take this opportunity to ask you, because we put everybody on the hot seat on this question. And that is, how are you going to do Thanksgiving with your family?
Yeah, I have one son in college who's coming home a week from today. So he has not been in our bubble, and I have a sophomore son here in town, and he's trying to avoid being in our bubble all the time. He's a teenage boy, so
Teenager.
So it's going to be the 4 of us. It's going to be quiet, and we'll probably speak with my wife's parents, my parents, and our siblings and their families, and try to do some FaceTime. But it's going to be a quiet Thanksgiving. Plus, I'm on call, so I might be operating. So we'll see. I think go back what Amanda was saying about these bubbles. When you get together with one person, it's still a risk, right? So you might have a bubble, and it's your one friend, but they have a bubble too, and you don't know what it is and who they've been around. And this can happen so quickly. And as Dr. Hawkinson said, you don't have any symptoms, but you're infectious. So you don't know, and it just takes one episode, and you could wind up getting it. So these numbers are really difficult to really wrap your head around, because certainly is there an increased risk if you're around 500 people? Yes, but it only takes one person near you.
All right. Next question. Are you seeing multi-system inflammatory syndrome in your COVID-19 patients? If yes, what is the symptom that children present with most? I know nobody here is a pediatrician, but do you know?
I know that we've had at least one more who would be considered a pediatric case who was here. There may have been more. Amanda can help me. And I think we may have had one adult, and I think it's just the typical things. Fever, overall malaise, not really feeling good. But we haven't had many, and I think our partners at Children's Mercy haven't had that many either. When I last talked to a pediatrician colleague, they had kind of intimated that even Children's Mercy haven't seen, although I don't know their full numbers, they have seen a few, but not a great number.
We do have people today and even yesterday that were asking about rashes, and they're saying that they have burning. They describe it as a burning rash, and they're wondering, I don't have any other symptom. Is that COVID? Is that the COVID rash they're talking about?
Yeah, I'm not aware of that right now.
Okay.
If that's your only symptom, who knows? I know people were talking about the Coveted Toes, which is another skin manifestation, but we have to understand that that is not distinct to COVID. Pernio is what it's called, and other entities can cause that as well. I had a colleague who developed something like that and had to go see a dermatologist, and they end up being COVID negative. So there are a lot of these are non-specific signs and symptoms of COVID. It's really difficult to tell.
Okay, we have 3 more questions, and this guy's got to get to the OR. I remember he told me that, so I'm going to try to get you out of here in a second. And if you have to leave, we will understand, okay? A lot of great questions today. The next question is, news reports indicate teachers and support staff are coming down with COVID-19, and it's impacting their ability to hold class. Are children spreading the COVID-19 to adults? Look in your crystal ball and answer that one. Amanda, are kids the spreading it and making the teacher sick?
Well, I don't know the specific answer to that. What I know is children can spread it, but so can adults. So I don't know that we can point our finger at any one demographic in this situation. The community spread is just running rampant, and really anyone could be spreading it.
Yeah, I would agree. I think, again, in those school buildings, we understand that a lot of the school buildings have taken as much safety measures and precautions as they can with de-densifying, distancing, masking. But we also understand that, unfortunately, people, just as here sometimes, we can see people who aren't wearing PPE properly, who may not be wearing masks all the time, or, teachers can still get together and eat together in a small room. That can spread it. We know that's happened with our employees. But we also know that, so in the classroom, it is probably about as safe as it's going to be, but children are able to spread it when they get home or they're going out and doing other things. We know that also the adults in that school system are probably going out and doing other things as well. So it's very difficult, just as Amanda said, to really pin it on, was this in school? Was it the child to the teacher? Certainly we know in the homes that children can have just as high viral titers in their upper respiratory tract as adults do. And we know that people who have no symptoms have high viral titers in their upper respiratory tract, just as people who have symptoms do. So all of these demographics, all of these groups can spread the disease just as easily.
All right, this next one I'm going to give to Dr. Coomer. At what point will the hospital or metro hospitals consider field hospitals to care for the sick? If we don't have enough staff, is that even helpful? Is that part of a plan?
Yeah, I think that's, that will be difficult. Certainly, there have been lots of talk recently behind closed doors talking about field hospitals and how do we staff that, and, do we get help from National Guard or the state and KDHD? So those are still being thought about. Obviously, we want to maximize what we can do in our own hospital and also the surrounding metro hospitals. So those are ongoing discussions, and you're absolutely right. I think we require some help from outside sources to help us staff these places.
All right, our last question this morning. How often, I like this question, how often do you have to see someone for them to be considered in your bubble? Is that what defines a bubble, is how often I see you? Because I see you almost every day, Amanda. Are you in my bubble?
I would say no. I think Dr. Coomer mentioned this or alluded to it earlier. Just because I trust you and I think that you're probably performing safe practices, I don't know everybody that's in your bubble and I don't know what their practices are. So I don't think it's really a matter of how often you interact with somebody. It's really understanding what are their behaviors outside of the interactions they're having with you.
I mean, I couldn't have said that any better.
You? Nope.
Oh, I'm not taking a stab at that. That was awesome.
All right.
Drop the mic.
You guys have done really good. I'm going to come to you in a second for your final thoughts. I just want to let the people at home know that on Monday, COVID-19 spread across Kansas and here in the metro. That's the topic. We don't have our guests yet because I'm calling people and asking them, people out in western Kansas, people in Wichita, if they would be so kind to join us and update what's happening there because it impacts us here. Lindsay sent in this photo. She says Wilma, who I love the pink collar, is keeping up with our updates, which is wonderful. And her son Harrison's T-shirt says it all. It is a good day to wear a mask. Do we have Harrison? We do? No. All right. So send us your breath cloud videos and mask videos. Harrison was really adorable. I'm sorry we didn't get to see him. All right. Final thoughts. Amanda, I will start with you.
Maintain our pillars of infection control. I know we're all very eager for Thanksgiving to come around and to spend time with our families, but we really can't let our guard down. And I know that's a really kind of harsh thing to think about. But it's still here. It's still around. We're still seeing rising numbers. So we've got to wear our masks. We've got to maintain our distance, keep our hands clean. Really those same elements of infection control that we've been talking about since March.
And we found Harrison. He agrees with you. I love his shirt.
Good.
It's a good day to wear a mask. Yay, control room. Nice job. Nice job. Dr. Coomer, what are your final thoughts?
Yeah, I echo some of the things that Amanda just said. Please stay safe out there and wear your mask, social distancing, and just common sense. I think those are important pillars. But, in my world with perioperative and procedural, I really wanted to say it's safe to come here. Please don't delay your care. It's very important. If you delay your care, it can wind up having more complications down the road. So the earlier you catch a cancer, for instance, the better outcome you're going to have. So please reach out to your doctors, your physicians, surgeons, whoever it might be. And we have the ability to do telehealth as well. So you don't necessarily have to come in for your appointment, but please seek care because it's safe and it's your life. Thank you.
Thank you. Dr. Hawkinson?
Yeah, we have just, the last 7-10 days have just been seeing increasing cases. It's really been dire news. This boils down to individual responsibility and individual behaviors. We understand people want to get together, but right now is not the time to do this. We need to all do what is right. Try not to get in groups, especially indoors. I guess 10 or 12 feet away on a driveway is okay. It's certainly getting colder, so that's more difficult to do. But do those individual behaviors so that we can decrease or flatten the curve again, especially as we move into the holiday season.
All right, and I personally want to thank you and Amanda because you keep us safe, and that's a good feeling. And I thank you at home watching because you are helping too when you take interest and you follow the thoughts and the advice that we're given by our fine physicians and nurses. So my final thoughts today are inspired by Dr. Stites and Dr. Hawkinson, who are always preaching that we should be intentional about staying positive during this pandemic. They encourage us to exercise, be thoughtful, read thoughtful readings, have thoughtful conversations, and listen to music. So as we head into the weekend, I want you to please enjoy this song that is sung by a group of residents. They're really amazing. They call themselves the Doctor's Notes. Stay safe, and we will see you Monday.